Hi, so today we're going to talk about 8 different types of NCLEX questions, right, that you want to be aware of. So let's go right into it. So the very first one, number one, is going to be questions that ask you to identify nursing interventions based on the symptoms given. So what this means is that you'll have a question and then it'll have a bunch of symptoms, but it doesn't have a diagnosis. And these are often going to be like your multiple choice or SATA questions. So you have to, in order to answer this question correctly, you have to think about what is the diagnosis of all the symptoms, not just the individual symptoms. And that requires you to do some critical thinking. Number two, identify pharmacology dosage calculations. So this is going to be more common on the NCLEX RN exam versus the NCLEX PN exam, but you still see on the PN exam as well. And this is where you have to be able to do fill in the blank. So, in order to answer these questions correctly, I recommend that you study formulas, dosage calculation formulas, in order to better understand how to answer these questions. Number three, patient statements. So, this is going to be questions where it will say the patient said this, right? And most of the time, it wants to see if you recognize if it's all of them or one of the choices that to choose. It wants to see if you recognize which statement puts the patient at risk, whether it's because it's going to put them at risk based on the medication they're on, based on the diagnosis that they have. So this is going to require you to understand the content of the drug, the side effects, as well as also of the potential complications or problems based on the diagnosis that they have. Number four is, of course, priority questions. Now, what I will say is that priority questions comes in multiple formats, right? It's not just only who do you see first, but there's also different ways that it can be characterized on the exam. So for these type of questions, it's going to come down to how well you understand how to prioritize care. And a lot of people don't realize this, but your understanding of the pathophysiology of that disease process influences how you prioritize the care. Number five is nursing process questions. So you probably never heard of this form of question before, at least not with, calling it nursing process questions. But this is referencing questions that combine nursing interventions and prioritization. So meaning, should you assess the patient first? For example, should you assess the patient first or should you isolate first? Right? So a lot of times the issue for many people is that your standard is to automatically choose assessment irregardless of the situation, when the correct answer is to only choose assessment based on what point are we in the nursing process of that scenario. Number six, keyword based questions. So, what I mean by keyword based questions is, have you seen those questions on the exam where we all love and it says, most important or best response or most appropriate? And I know for a lot of people, that's the type of question that they hate the most. But I call them keyword based questions because they focus more on how well you can pick the answer based on the specific type of wording it's giving you. So the way that you ask the question is that, one, you can't rush through the question, right? And then two, you really honestly have to make the connection with choosing the answer that's most specific to that disease process, that drug, or that procedure, or however the situation may be in the question. So the reason why people pick the answer wrong is that your answer is still too general. So meaning that you pick an answer, let's say the scenario has to do with surgery, and you pick an answer that has to do the recovery of surgery, but the question is specifically focusing on eye surgery. So you're supposed to pick an answer that's most specific to eye surgery, not just surgery. So this is one of the reasons why people get the answer wrong, is because your your answer is too general and you're not really being specific to what it's really asking you. Number 7 is side effect related questions. Side effect related questions. I think a lot of people get these questions wrong the most because it's really easy for you to mix up the side effects of different medications and not realize that it's hinting the side effects in the question. So honestly, there's not really a fast cut to this question. To get it correctly, you just honestly need to know the side effects, and you need to study different groups of medications and know their side effects versus their adverse effects. So really be able to understand, what is the side effects, at least at minimum two side effects at minimum per medications. Obviously, there's thousands of medications, but knowing the medications that's most commonly given. And then number 8, the last question type are visual questions. Visual questions. So I mentioned this one because it's becoming more and more popular on the exam. So what this will look like is that you need to be able to at an image, right? But it's in the form of a question. And then identify, and then depending on if it's like a pointer graph or chart type of question, but be depending on the image, be able to identify either what the image is pointing to or what is the interpretation of the image, which could also be EKG questions. So visual questions is going to be your ability to look at an image and be able to identify either what exactly is the part that it's referring to or what's the interpretation of what it's telling you of the image. And so if you don't feel comfortable with anatomy and physiology, then this will be more of a challenge for you. And if it's been a while since you've been exposed to clinical settings, then as well, this can be more of a challenge for you. So this is why the foundation is going to be, knowing the anatomy physiology in order to answer visual questions. Like, for example, knowing the valves, knowing the location of the valves, right? Knowing lead placement. Those are examples of visual questions. So those are 8 different types of nursing questions. And I think we have time, real quick, actually, to do a quick practice question. The question says the nursing team on the medical surgical unit consists of an RN, 2 LPNs, and a nursing assistant. Which of the following clients should be assigned to the nursing assistant? 1, a client recently diagnosed with a seizure disorder. 2, a client 2 days post-op of vaginal hysterectomy who needs to use the bathroom. 3, a client recovering from electrolyte imbalance. Or 4, a client recovering from appendicitis who has a few questions about recovery. If you need more time, stop this video so you can get more time. So here's the reality of this question, right? So it says that you have a nursing team and it asks you which one should be given to the nursing assistant. The nursing assistant is somebody that handles that, vital signs, somebody that can collect data, but it's not licensed to give medication or do assessment. So the best answer, and it's ideally a patient that's more stable. The best answer is going to be 2, right? The client 2 days post-op from a vaginal hysterectomy who needs to use the bathroom. 2 days is great. They're probably more stable at this point. The client who has a seizure disorder would need teaching and assessment. That's an RN, right? And an RN should do the follow-up. A client recovering from electrolyte imbalance, that would probably be best for the LPN. And then a client recovering from appendicitis who has questions about his recovery, that would also be an RN as well. All right. So I hope you found this helpful. If you did, let us know that you did. Comment below. And then if you need more help, visit our website, or actually you can connect with me by going to bit.ly/NCLEX to schedule a phone consultation. If you want to take advantage of our review programs, go ahead and click above or below or comment below this video to get access to our programs. Thank you so much for watching, and I hope you have a wonderful rest of the day.